Hi, I'm Dr. Parminder Kaur. I'm from Motherhood Fertility Center. I'm a graduate and postgraduate from Government Medical College, Srinagar. Have done my DNB from Sector 16, GMSH, Chandigarh. Then I did my fellowship in reproductive medicine under Dr. H.D. Pai for last 7 to 8 years in Fortis Bloom, Mohali. Presently, I am working as a consultant at Motherhood Infertility, Sector 43, Chandigarh. See, in our hospital, we have various checkpoints, we have various stages. So the first and the foremost step is that every file we put in a checklist that is put in the front. So all the points are labeled there, and our staff ensures that each point we are complying with each and every point as per the ART law and regulation, and we check each point. Then there are, we have designated specific people for the checking of the file. And in spite of that, we do audits. Very regularly audits are being done in our unit so that we don't miss on any important thing and everything is in place and legally sound. Informed consent is defined when a couple visits and you talk to them, you explain the whole procedure, like how and what you are going to do, and what are the good effects and what are the bad effects, because every medication, every procedure we are undergoing, it has a certain extent of some side effects which need to be explained in detail to the couple. So we explain each and everything, and after that we asked both the partners if they are willing to take the procedure and if any queries they have. And when after understanding each and everything they sign the documents, that is known as the informed consent. So implication of informed consent is that our couple knows exactly what is going with them, how they will proceed with the procedure, what are the treatment options they have, and they sit with their doctor and they together as a team, they select the best treatment and they go ahead with it. So it is very important to do a detailed counseling and take the patient, which includes both the partners as a couple, into consideration. See, when we make embryos, embryo is a genetic material, so it's very important and very it's a genetic material. It's a thing which we cannot just discard like that. So once we transfer into a couple and they get pregnant and we have extra embryos, we inform them, we tell them to visit the hospital. We give them enough explanation whether they want to continue freezing those embryos or they want to discard. Then they as a couple, both husband and wife, they have to give their written consent if they want to discard the embryos. We cannot take decision on our own. Yes, definitely. The ART law, which has recently come up, it was everywhere in the newspaper, in the media. So this law has given us guidelines. There are very strict criteria which we have to meet. So if a female is going for egg donation, her age limit has to be between 23 to 35 years of age. A man who is donating his sperm has to be around 21 to 55 years of age. And a couple who is accepting egg donation or sperm donation as a IVF option treatment, the age of the female has to be less than 50 and age of the male for that matter has to be less than 55. So we have to comply each and every law which comes under the ART rule by the Government of India. Yeah, patients come to us with a long list of queries. They have so many issues. What's going to happen if we do this, if we do that, like there are n number of questions. And at our center, we try to help them, understand them and guide them as per the ART law. We are the center, I think most of the centers, of course in and around Tri-City and Motherhood being one of them, we are fully compliant with the ART rules and regulations, and we help our patients keeping the law in mind 24/7.